Hi, I'm Babette Edgar, and I'm here with Deb Sternaman and Peter Lee, and we're talking about the future of managed care pharmacy. Deb and Peter, can you tell us a little bit about where you work and what your positions are?
Sure. I'm at Catamaran in the PBM space, and I work as the Director of Commercial and Medicaid Formulary Management and Essential Health Benefits now.
Okay.
I work for a company called PharmaCore. It's owned by a larger company called Horizon. We serve about 300,000 correctional lives around the country. So as a Senior Director of Pharmacy, I take care of PNT, formulary, and manufacturing, contracting, things like that.
Great. Well, thanks for taking the time to talk to me today. I know you're both very involved with AMCP and the promotion of managed care. And so we're thinking a little bit about 5 to 10 years from now, what the practice of managed care is going to look like and what pharmacists will be doing. You have spaces such as accountable care organizations and patient-centered medical homes and the exchanges. So what do you think pharmacists will be doing, and how will they be practicing managed care principles in the next 5 to 10 years?
So it's interesting because right now we're going through the whole implementation of insurance exchanges, which I think is really changing a lot. We have the Affordable Care Acts, but we're taking it to the next level with these insurance exchanges. So I think that will be managed care pharmacy in general will be more active and more upfront because of these insurance exchanges. So we'll have pharmacists out there, doing more medication therapy management. The insurance exchanges are really going to hit home that not just in the Medicare area do we need to be doing these things, but we need to be doing it across the board. And that the insurance exchanges really need to be the model of all of the things that we need to offer and really take it to the next level for members that are out there, including members that currently don't have coverage. So that's the initial part. But coming up, I think we're at this crossroads of whether or not we're going to move to, in the country, more of insurance for all, or privatized insurance, or if it's going to still be a combination of both, and it's not really sure which one it's going to be or what's going to happen or how it's going to evolve. But definitely the insurance exchanges are really taking us to that point, and all of the requirements with that are kind of mirroring Medicare Part D, but taking it into the commercial space.
And Peter, what are your thoughts on that?
I think the key difference in the future, 5 to 10 years on, is what the role of digital technology can impact our practice. The setting that I am is a pseudo ACO model where all the healthcare physicians and nurses are employee of the health plan, you would call that. Mm-hmm. We use EMR, EHR, and having that electronic data, a pharmacist could actually digitally manage our patients on insulin. So we're not quite there yet, but with that kind of data, we could do so much things even remotely away from being a face-to-face contact. And managed care pharmacists being in the middle, I think, will be a crucial player between physicians and nurses and also payers and also pharmaceutical industry. And to communicate that only can be done by a digital manner. Whether it be tech hardware-based, or it be iPad or anything, where most likely, I believe it's going to be in the software. Because software is where innovation is happening, applications at either iPhone or Android phone. That's what we're having. My dream would be to have a iPhone-sized EMR scanner where actually at a hospital setting, you scan when the medication is given to the patient, and the very next day, you get discharged, that physician would say, oh wait, you were in this medications, well, let me continue on that medication. That information is shared to retail pharmacy and ultimately roll up to a managed care pharmacist, to not only the MTM services, to the DUR services, also look for opportunity to bring the cost savings down. I think that is possibility with the technology that's moving forward.
So do you think pharmacists have the skills getting out of their residencies, getting out of pharmacy school, to be able to handle these new practice roles? Or what do you see needs to happen for managed care pharmacists to be trained?
I'll take that one first, Deb. I actually asked the question.
Okay.
For my personal sake, I have asked about 5, 6 AMCP leaders. I will name them, their president or president-elects, former, and the board of directors, about their thoughts about 5, 10 years from now on, and how I, as a pharmacist in 10 years of training, would be in a proactive role impacting the future. Now, as I have students kind of come with me, working with me, I think about them, how their life is going to be in 10 years from now on. And what they have told me is one of the number one things that pharmacists is not ready for is technology, health IT. I don't have the skills. Deb might have the skills, but I don't have that. So
I certainly don't have it.
I'm pretty good with electronics, let me just tell you. But I agree. I don't think that anybody right now is prepared for all of the things that are going to happen. I think there's certainly training that we can do or we can incorporate into residencies and pharmacy school rotations and those type of things that kind of bring it to the forefront. I mean, just even in EMR, the exposure that you get is so limited as a pharmacist, even on rotations right now,
yes,
let alone, a few years back. So people have been out for a few years. It's so limited that I almost feel like we have to make sure that that's part of what they're getting when they're in school and when they're in hospital or institutional rotations, that they're actually, or even in a physician's office, that they're learning what EMR does and how it can integrate. Because I think they see EMR as like, oh, it's just an electronic medical record, but not that it can integrate to, the pharmacy. It can integrate to a patient-centered medical home where another physician could potentially see what's happening. But that's not always happening right now. But in 5 years, 3 years, even down the road, it's going to be happening more. So we need to make people really think that, okay, we need to realize that this might not be where it is now, but it's going to happen soon, so you need to be familiar with it.
So, I mean, there's so much information now that managed care pharmacists need, clinical and technology and policy-based. Do you see the possibility of specializations within managed care?
Oh, I think definitely. Just looking at managed care pharmacy hits every aspect of pharmacy. So whether or not you think you're a managed care pharmacist, you're a managed care pharmacist. You're working in the retail clinic, you're a managed care pharmacist. You're dealing with, insurance things, you're dealing with dudes listening to prior authorization, et cetera. So I certainly think that there's areas of specialty within managed care pharmacy. Right now alone, you could go into, Medicare, or you could go into specialty and really focus on that area. And now, we have insurance exchanges, you can focus on that. There's, various co-ops, and there's so many things that are happening in managed care, especially with the government dictating it, that I think that, residencies could be focused in an area, or just like, if you're not in managed care, you could be working on, just a primary care, and then you specialize afterwards. That you could do a managed care, like kind of general residency, and then focus in an area. Say, Medicare Part D is where I want to work, but I need to know a lot more about it. And there's, you have to have the online prescribing, electronic prescribing. You have to have all these things available that you really need to focus there and understand all the needs, because just somebody coming out of a general managed care residency has just bits and pieces of things, and you have to be able to focus or work for a long time in that area.
Great. Anything you want to add, Peter, to that?
No, the great points.
Lengthy.
I think it's happening already.
Yeah.
Many students, 5 years ago, dual degrees were not common. Maybe even MBA or MS. Now we have folks coming out with technology degrees, MS in regulatory affairs, MBA is common, MPH, PhDs.
Right.
So that specialized is already happening. I think one thing is lacking though is pharmacists. When you go into pharmacy school, you tend to recruit certain type of people for that job. I think we need to expand the folks that might be interested in pharmacy, and then have the IT guys who have interest in science to consider pharmacy as a profession, not necessarily a dispensing role, but the go-to guru for integrating data from pharmacy side, IT side, and also medical side. Why can't pharmacists do that? Absolutely, pharmacists could do that.
Agree. Well, thank you very much, both of you, for your time today. It's been a pleasure.
You too.